Welcome back, folks. Well, did you know that there's roughly about 500 people right here in the Valley waiting for a kidney transplant? Well, right now we have Dr. Murad Al-Sabag. Thank you so much for joining us here today on Inside the Valley. We really appreciate you coming on.
Thank you very much. Thank you for having me. I think this is a very good opportunity for me to give a good awareness to the people in the Valley how important is the kidney and the kidney transplant.
So tell us a little bit more about, I know there's like about 500 people waiting, and so why is that number so high?
Well, kidney disease is a very common disease, unfortunately, in the country because diabetes and hypertension are the main two reasons for kidney failure, and it is very common in the country, considered to be one of the top 10 really difficult diseases in the country to take care of. And unfortunately, patients who develop kidney failure, they don't have too many options. They just do have either dialysis or transplant. It's a irreversible disease, the kidney failure.
Wow. And so what do people do? So they need a transplant, and so they then get put on that list.
Yes, so the first patient will be evaluated by his kidney doctor as recognize him as a kidney disease patient, and they will stage them. There are about 5 stages of the kidney disease. The last stage, which when the patient is indicated for dialysis, at that time the patient also will be referred to the transplant center. And the transplant center will do all the workup and to see if this patient is eligible to be a candidate, then we will put the patient on the list for kidney transplant.
And so what are some of the symptoms, or I guess, of kidney disease, or what should people be looking out for?
That's a very good question, because people will really surprised that generally there's no significant symptoms of kidney disease. The patient could have the kidney disease going on without even being aware about. Unfortunately, the patient will find out that he or she has a kidney disease only when they do the labs, or when they have advanced kidney failure, which is having the kidney failure symptoms, including swelling and accumulation of fluids and accumulation of the toxins in the body, and at that time the patient will have the symptoms. Unfortunately, that is too late in the disease. But in early stages of the disease, the only way to find is to do the blood test, and that's why I recommend all of my patients, especially who do have diabetes or hypertension, to continue following up with their primary doctors and to be sure that they are having a better control of their diabetes and hypertension to slow down the progression of the kidney disease.
Now, I know you mentioned diabetes and hypertension. Now, are these some of the causes of kidney diseases?
Yes, there are like good number of causes of kidney disease, but the most common reasons for kidney failure is diabetes, about 30%, 30 to 35%. Hypertension is about 25 to 30%. So both together about 60 to 65% of the reasons for kidney failures. There are other reasons like inflammation, autoimmune disease, and inflammation in the kidney, and other less frequent reasons.
And I know that diabetes is an issue right here in the Rio Grande Valley, so it's so important to kind of keep in check with your doctor and keep letting them know and keep in contact.
That is correct. Unfortunately, more than 40% of the population in the valley have diabetes. Unfortunately, each family in the valley mostly has a diabetes disease. So it is very, very and highly recommended for patients to continue following up with their physicians, to do the best in their diet and their exercises, and keeping up with controlling their diabetes.
And so that could then, take preventative steps too before you get to that kind
Correct.
of point.
Or slow it down.
Exactly. And so people have, and if it gets to that kind of stage where it's irreversible and you're going to need a transplant, how does that process work?
Okay, it is a long process. It started with referring the patient to the transplant center. Then we see the patient. We have a multidisciplinary team, physician, surgeon, pharmacist, and the rest of the team. We all see the patient. We do a full evaluation. Then we'll make a decision if this patient is a good candidate to be placed on the wait list. There are 2 kinds of kidney transplant donations. Deceased donor, which is when we put the patient on the list, and at that time the patient will wait for a kidney from somebody who's about to die, and the government control all of this.
Okay.
And the other one is the living donation.
Okay, and what is a living donation?
Living donation is when a family member or a friend offer to give a kidney to his significant, and in this case, we will evaluate this person. He's supposed to be healthy, 120%, no kidney disease, no heart disease, no any other, no cancer, no any other disease, obviously no smoking or drinking. And if this donor good candidate to donate a kidney, will arrange for the surgery.
Wow.
This is way much better than the deceased donor because of two reasons. The first reason, the patient really don't need to wait. The wait time in Texas is about 6 years, imagine. So 6 years on dialysis is really long time.
Definitely.
Versus about 3 months of evaluation of living donors. So 3 months versus 6 years is really significant difference. The other important reason, we know by fact kidney from living donor is much better than kidney from deceased donor because it's from somebody who's healthy.
And where can people go if they want to donate or get more information about being a donor? Where can they go? Any numbers or website?
Yeah, they can go to the website of donatelifetexas.org, or when they renew or get their license, driver license, they can make themselves as this is about the deceased donor, as a registered donor. And for a living donor, they can call our transplant center or the transplant center they are interested in. I am working for DHR, Renaissance Transplant Institute.
So people can save a life, and that's really amazing.
That's correct, actually. A person who registered himself or herself as a registered donor can save 8 people's life. Not only donate kidneys, they can donate heart, lungs, and kidneys and liver and the rest of organs. Yeah.
Well, that's amazing. Well, thank you so much, Dr. Al-Sabag. I really appreciate you for coming on here and talking to us today.
Thank you very much, and thank you for having me.
Well, that's going to do us for here on Inside the Valley. We hope to see you next weekend.